Let me ask you something direct. You've been cutting salt, maybe for years, and your blood pressure is still not where it needs to be. That is not a willpower problem. That is not a discipline problem. That is an information problem, and it ends today. Because sodium restriction is real medicine. I'm not here to tell you that was wrong advice. It wasn't. But it is half of the equation. And the half nobody explained to you. The mineral your arteries are waiting for right now is the reason those numbers keep climbing no matter how carefully you read a nutrition label. That mineral is magnesium. Over 68% of American adults are deficient in it. Among people over 60, that number is higher. And if your blood pressure has been resistant, stubborn, unmovable despite everything you've done right, magnesium deficiency may be exactly why. I'm Dr. Sarah, and before this video is over, I'm going to give you a 5-question self-check that tells you in the next 90 seconds whether this deficiency is silently working against you right now. Then I'm going to show you exactly which foods correct it and what happens inside your arteries when they do. Stay with me. This is the other half of the conversation. If this channel is new to you, please subscribe right now because what you're about to hear may change how you think about your cardiovascular health permanently. Before we go any further, I want you to answer 5 questions honestly. 1. Do you experience muscle cramps, especially at night, in your legs or feet? 2. Do you wake up tired even after a full night of sleep? 3. Do you feel anxious or on edge more than you used to? 4. Have you noticed your heart occasionally beating irregularly or with what feels like a flutter? 5. Has your blood pressure stayed elevated despite cutting sodium and taking medication as prescribed? If you answered yes to 3 or more of those questions, there is a very real possibility that magnesium deficiency is part of what is working against you. Not the only factor, but a significant one that has never been directly addressed. Keep those answers in mind as we go through this together. Here is what magnesium is actually doing inside your body. And I want you to understand this, not just hear it, because once the biology makes sense to you, everything else clicks into place. Your blood vessels are not passive tubes. They are living muscular structures, and the muscle cells in your arterial walls are in a constant state of conversation with your nervous system, receiving signals about whether to contract or relax. Magnesium is the mineral that sits at the center of that conversation. Here is the first mechanism. Magnesium acts as a natural calcium channel blocker. Now, if you've ever been prescribed a blood pressure medication in the calcium channel blocker family, like amlodipine, this will mean something to you immediately. Calcium causes smooth muscle cells in your artery walls to contract. Magnesium blocks calcium from flooding into those cells. When magnesium levels are adequate, your arteries stay relaxed and open. When magnesium is deficient, calcium moves in unchecked. Your arterial walls tighten. Your heart pushes harder. Your pressure rises. This is not a theoretical mechanism. This is the same mechanism that an entire class of prescription medication is designed to replicate, and your body has been trying to do it naturally for your entire life, with magnesium. The second mechanism, magnesium directly supports the production of nitric oxide, the molecule your artery walls use to stay relaxed and elastic. I've talked about nitric oxide on this channel before in the context of other nutrients, but magnesium's role in sustaining nitric oxide production is independent and critically important. Deficient magnesium means less nitric oxide. Less nitric oxide means stiffer, tighter arteries. Stiffer arteries mean higher pressure, day and night, around the clock. The third mechanism is one that surprises almost every patient I share it with. Magnesium directly influences how your nervous system responds to stress. When magnesium levels are low, your sympathetic nervous system, the fight or flight system, becomes overactive. It fires more easily, more often, with less provocation. And every time that system fires, your blood pressure spikes. In a magnesium-deficient body, that spike happens more frequently, climbs higher, and takes longer to come back down. This is why anxiety and elevated blood pressure so often appear together in seniors who are unknowingly running a magnesium deficit. 3 mechanisms: arterial relaxation, nitric oxide support, nervous system regulation. All 3 working in the same direction. All 3 compromised when magnesium intake drifts too low. I want to tell you about a patient named Beverly. Beverly was 71 years old. She was a retired pharmacist from Louisville, Kentucky. If you know pharmacists, you know they take health advice lightly. Beverly had spent 35 years dispensing blood pressure medications and counseling patients on their use. She understood pharmacology at a level that most patients never approach. Her blood pressure was 154/94 on 2 medications. When Beverly first came to see me, she was frustrated in a way that was almost professional. She told me, "I know what these drugs do at the receptor level. I know the mechanism. I have done everything correctly, and I cannot understand why my numbers look like this." Beverly had virtually eliminated sodium. She exercised regularly. Her weight was appropriate for her age. She had read everything available about dietary interventions for hypertension. She was taking her medications exactly as prescribed. What Beverly had never once been told to pay attention to was her magnesium intake. When I looked at her dietary records, the picture became clear almost immediately. Beverly's diet, while genuinely careful about sodium, was almost completely absent of magnesium-dense foods. She rarely ate leafy greens. She had moved away from nuts because of the calorie concern. She didn't eat seeds. She had even reduced her bean consumption because of a digestive issue the year before. She had been unknowingly running a magnesium deficit for years, and her arteries had been paying the price in the form of precisely the kind of persistent elevation that medication alone couldn't fully correct. We made targeted changes to her diet. Within 8 weeks, her readings were averaging 136/82. Beverly's response when she saw those numbers was not relief. It was something closer to professional indignation. She said, "Nobody taught me this in pharmacy school. That's a problem." She was right. It is a problem, and it's why you're here today. Let me give you the specific foods. These are available at any grocery store in America. They are not expensive, and once you understand what they are doing inside your arteries, you will look at them completely differently. Food 1. Dark leafy greens, cooked. A single cup of cooked Swiss chard delivers approximately 150 milligrams of magnesium. Cooked spinach provides around 157 milligrams. These are not trivial amounts. A cup of cooked spinach gets you nearly 40% of the daily magnesium target associated with meaningful blood pressure benefits. And as I mentioned in a previous video, cooked greens are also among the highest potassium foods available, so you are hitting 2 of the most important blood pressure minerals simultaneously in a single side dish. Food 2. Pumpkin seeds. This is the food that surprises virtually every patient I mention it to. 1 ounce of pumpkin seeds, which is about a small handful, delivers approximately 150 milligrams of magnesium. That is more magnesium per ounce than almost any other food on the planet. They are small, they require no preparation, they can be added to yogurt or oatmeal or eaten as a snack, and from a blood pressure standpoint, they are an extraordinarily concentrated source of what your arteries are looking for. Food 3, dark chocolate, at least 70% cacao. I want to watch your reaction to this one because almost every patient I mention it to either looks confused or suddenly very interested. 1 ounce of dark chocolate with at least 70% cacao content delivers approximately 64 milligrams of magnesium. It also contains flavonols, compounds that independently support nitric oxide production in your artery walls. The clinical research on dark chocolate and blood pressure reduction is genuine and replicated across multiple studies. 1 small square of quality dark chocolate after dinner is not an indulgence you need to feel guilty about. For seniors managing blood pressure, it is evidence-based nutrition. The key is cacao content of 70% or higher and portion size of 1 ounce. This is not a license for a full chocolate bar. 1 ounce, consistently. Food 4, black beans and legumes. 1 cup of cooked black beans delivers approximately 120 milligrams in addition to its potassium content. The magnesium and potassium combination in beans make them perhaps the single most blood pressure targeted food group available in the standard American diet. If you are eating beans twice a week, you are giving your kidneys, your arteries, and your nervous system something they are genuinely asking for. Food 5, almonds. 1 ounce of almonds provides approximately 76 milligrams of magnesium. They also provide healthy fats that reduce arterial inflammation and a meaningful amount of protein. A small handful of almonds as an afternoon snack is one of the simplest and most consistent upgrades a senior managing blood pressure can make to their daily routine. This brings me to a man named Earl. Earl was 74, retired truck driver from Knoxville, Tennessee. He was not a man who enjoyed sitting in doctors' offices. His daughter had essentially dragged him to my practice after his blood pressure hit 168/101 at a pharmacy screening. Earl looked at me in our first appointment and said, "Doc, I'm not eating rabbit food. Tell me what I actually need to do." I appreciated his honesty. I didn't give Earl a meal plan. I gave him 2 things: a bag of pumpkin seeds to keep in his truck, and permission to eat 1 square of dark chocolate after dinner. That's it. That was the starting point. He thought I was joking. He called my office 45 days later, and his home monitor was reading 147/88. He hadn't changed his medication. He hadn't overhauled his diet. He had added 2 things, both of which he genuinely enjoyed. He called the dark chocolate part the best medical advice anybody ever gave him. Now, here's the picture I need you to understand fully. The modern American diet has moved almost completely away from the foods that deliver magnesium. Processed grains have had their magnesium stripped out in refinement. Fast food contains almost none. The convenience foods that line American grocery stores and that many seniors rely on for their simplicity, virtually none of them are contributing to your magnesium status. And here's the piece that makes this a true crisis rather than just a nutritional inconvenience. Stress depletes magnesium. Every time your body mounts a stress response, it burns through magnesium. Diuretic medications, which millions of seniors take for blood pressure, flush magnesium out through your kidneys alongside the sodium and water they're designed to remove. Even coffee, consumed in quantity, increases magnesium excretion. The very conditions of a senior's life, stress, medication, a contracted and simplified diet, All of them are pulling magnesium downward simultaneously. And all the while, the blood pressure stays high, and another medication gets added, and nobody stops to ask what the body is missing. I need to pause here because I would not be doing my job if I didn't address this directly. Magnesium supplements are widely available, and I understand the temptation. You've just heard all of this and you're thinking, I'll buy a bottle tomorrow. I want you to hear me carefully on this. Dietary magnesium from food is almost always the correct first approach. It is safe, it is absorbed well, it carries no risk of excess when it comes from food. Magnesium supplements are a different matter. Certain forms can cause digestive problems. In people with kidney disease, excess supplemental magnesium can create serious complications because impaired kidneys cannot regulate mineral levels the way healthy kidneys do. If you are considering a magnesium supplement, please have a conversation with your doctor first. Ask to have your magnesium level checked. Ask specifically whether your current medications affect magnesium status. This is a straightforward conversation that takes 5 minutes and protects you from making a well-intentioned choice that works against you. Food first, always. Supplements only with medical guidance. That is not excessive caution. That is what it looks like to take your health seriously. Here is what I want you to actually do, starting today, not tomorrow. Step 1. Add 1 magnesium-rich food to every single meal, not a complete rebuild of how you eat. 1 addition per meal. A handful of pumpkin seeds on your morning yogurt, a cup of cooked spinach with your lunch, a small portion of black beans stirred into whatever you're having for dinner. Step 2. Replace your afternoon snack deliberately. Whatever you are currently eating at 3 or 4 in the afternoon, crackers, cookies, whatever it is, replace it with a small handful of almonds. You will not miss the other snack after 2 weeks, and your arteries will be receiving something they have been asking for. Step 3. Add 1 square of dark chocolate after dinner, 70% cacao or higher, 1 ounce, every evening. This is not a treat that undermines your health. For most seniors managing blood pressure, it is evidence-based nutrition that happens to taste like a reward. Step 4. Tell your doctor. At your next appointment, say, I have been learning about magnesium's role in blood pressure management, and I would like my levels checked. Ask whether any of your current medications are affecting your magnesium status. That single conversation could change the direction of your treatment. I want to leave you with this. Every time you reach for a handful of pumpkin seeds instead of a cracker, something real is happening inside your arteries. The smooth muscle cells in those arterial walls are receiving calcium-blocking protection they may not have had in years. Your nervous system is getting the mineral it needs to stay calm instead of firing on high alert. Your nitric oxide production is being supported. Your blood pressure management system is being given a tool it was designed to use, that your diet had quietly stopped providing. You are not just snacking, you are physiologically intervening in your own cardiovascular health in a way that science fully validates and that your body is entirely equipped to respond to. That is not a small thing. That is a genuinely powerful act that happens every single time you eat. If this gave you something your doctor hasn't taken the time to explain, please subscribe right now and share this with someone you know who is still fighting these numbers without understanding what their body is actually missing. Before you go, I want to hear from you in the comments. Which of these foods are you already eating regularly, and which one surprised you most? Tell me below. Your answer might be exactly what someone else reading the comments needs to hear today. I'll see you in the next video. Take care of your body. It is working far harder for you than you know. In my next video, I'm going to show you the 3 morning habits that are quietly spiking your blood pressure before you've even had breakfast. You won't want to miss it.